And welcome to Mommy Diaries. This show is about parenting, motherhood, and this amazing journey ya ho hodisa bana ba rona. On today's show, I am so excited. I have Dr. Phetla. She is just amazing. Doctor, now on my show, I like it when people tell me about themselves. Who is Dr. Phetla?
So Dr. Boitumelo Phetla is a wife and a mother of 3 kids. Medical doctor by profession. I call myself a doctorpreneur. The reason for that is I have special interest in healing and I also have interest in business. So I further went to do my MBA, Master of Business Administration with Regenesis, my medical degree from University of Pretoria. I have special interest in the space of medicine and healing, in oxidative stress management.
Okay.
So oxidative stress management is about understanding stress of the body at a cellular level, which means if we understand what goes wrong at a cellular level, then we can correct, because all of the problems that we have essentially start from the cell level. So my passion is around that, and with that, then I evolved to develop interest in nutritional supplements. So with my interest in oxidative stress management, it opened up the opportunity for me to start researching more on nutritional supplements, because we discovered that there's actually a big gap in the health space with nutritional deficiency. And the interesting thing is the nutritional deficiency is not like the old picture we had of a poor black kid. The nutritional deficiency is in the average person that you meet on the way, looking beautiful, successful. So we have nutritional deficiency in the middle and upper class. So with my supplements is to fill in that gap, to manage the oxidative stress, prevent disease, reduce the impact of disease, and improve prognosis. I also have a foundation, Dr. B.B. Phetla Foundation. I'm focusing on young people, especially in high school and university students that need the support. The kids have potential, but they have struggles. So I just come in to just elevate them and support them to be the best version of themselves. Special interest for them is in leadership, entrepreneurship, and wellness. That's my focus.
Sure, you do a lot. And when do you get time to spend with your kids?
Somewhere along the line.
You find a way.
Yes.
Yeah. So, Doctor, when I met you, you spoke so beautifully go eventing in Ikiloko, and one of the things that stood out for me is that, like, you know, the nutritions and lack of things that we have. And I was like, vitamin D.
Vitamin D.
I was feeling maybe so maybe I don't. I lack vitamin D. I even said I want to go for tests to check.
Yes.
Tell me a bit about, before we dive into the topic ya ona menopause, vitamin D. Vitamin D or
Yeah, so vitamin D is a naturally occurring vitamin. We get it from the sun.
okay.
And then the sun hits the skin, then the skin will basically synthesize the vitamin D for us.
Okay.
So vitamin D is central to regulating our immune system. It's also central to regulating cell growth.
Okay.
And what most of us know about vitamin D is its function around the bones, calcium. That is what most of us know. But the knowledge around the immune regulation, the cell growth regulation, is something new for some of us that we never knew. I don't remember if they taught us in one of my lectures at university.
Yeah.
Yeah. So with that, it basically revolutionized how we do medicine now.
Yeah.
And in terms of disease prevention, and we know now the prevalence of disease is sky high.
Sure.
Even prognosis are not so good, and let's keep in mind the urbanization that comes with it. So the lack of vitamin D is primarily around the urbanization. Since democracy, the average black person now has a car. No one is walking anymore, and the sun is at its peak between 10 a.m. and 2 p.m. But where's everybody at that time? We're all in the office. We're under the shade, underground, and now the healthy people in our society now are people that are working in the sun. The builders, people working on the farms, people working on the beaches. Now the average person has a low vitamin D, which has serious implications in terms of health.
Sure. So what can we take to, because I'm not going to run out while I'm on set shooting to go get the sun and come back.
Exactly. So that's where the supplementation comes in, and the supplementation at the right levels, and it still does not replace the sun. So you supplement at the right levels, but every moment you get to get the sun, you have to get the sun, because there are certain benefits that you can only get from the sun. So the supplementation is coming in to fill in a gap that was not naturally there, because of how we're doing things has changed. So now we have to factor in that change of this is how we're doing things these days. And failing which, unfortunately, there's ripple effect in terms of a negative ripple effect, how we feel, energy, focus, reproductive system. All systems are actually affected by vitamin D levels.
And now let's talk about women's health. One of the topics that I'm reading a lot about for some reason is menopause. Number one, it's because I'm 36. Number two, I hang around with older people who are going through menopause. Number four, I don't remember my mom talking about it. But I'm not saying that she didn't go through it. But I don't remember my mom or maybe I didn't pay attention. But I don't remember anything like that happening to her. What is menopause?
Menopause is a state where our reproductive system shuts down. Reproductive system is basically the system in our body that produces kids. So it's the hormones, and an egg is released every single month to be matured for a potential pregnancy, with which, if it doesn't happen, then you have menses. So the whole idea of reproductive system is basically to create a baby. So now once the body reaches that stage where it says, okay, we've done our part, that's it, we shut down, we close. There's a consequence of estrogen levels dropping. And menopause doesn't just happen like that. It's a gradual thing. Then we have perimenopause, meaning we are around the stage of menopause, which can start anything from 35. So you do have to know about menopause as we speak, because you're in the perimenopausal stage. So anything from 35 years, most women hit their menopause, average about 51 years of age. But anything from 35 years of age up to that 50, 51, then you start having those symptoms that we classify under menopause. So it's going to present the most common one is the hot flashes, irritability, the mood swings, vaginal dryness, headaches. So it can be any diagnosis, basically, like from what I'm listing. So it can be anything, but you'll notice just a change in how your body is functioning.
Okay, and then some people don't go earlier than 35. It starts from 35.
Even the 35 is on average. So in medicine, there's always on average.
On average, yeah.
So meaning there are always exceptions.
Okay.
So there are those that will have a premature menopause, which is not common, but it's happening. And I think also because of the urbanization, changing the lifestyle, what we're eating, how we sleep, stress levels, and all of that, they do affect our immune system. Immune system will affect our hormones. So everything is interlinked. So with the change in lifestyle, we do have ladies that actually have premature menopause, and that is something that has to be diagnosed. It's not obvious to know that, okay, this is, obviously it's concerning. If you're before 35, your periods have stopped, or you start having hot flashes. Sometimes it can present as infertility, only to find out that it's actually a premature menopause. So that needs proper investigations.
So for women who have conceived, and for women who, like, let's say a woman who hasn't had kids, does menopause affect them differently?
Not really. I would say it's more your makeup, your lifestyle, the things you eat, because all of that have an effect. Your vitamin D levels, because that is such a pivotal thing. We discovered that it's such a pivotal thing. Do you exercise? Are you sleeping well? Are you managing your stress? Are you taking toxins, alcohol, smoking? They all have an effect on your body. So it depends how you're taking care of your body. That's why you have somebody who is older but doing better than somebody who's younger. So that tells you that the common thing is the individual choices that one takes on their own health.
So if you drink and smoke, and it will affect your the symptoms of menopause.
100%.
Doctor.
100%.
Nizwile. So if you smoke and drink, it will like, how does it affect it? The symptoms become worse than an average person.
Yeah, so they become worse because basically smoking and drinking, without making it like sound like it's the worst thing, because
course.
sugar has a similar effect.
Yeah.
They do cause what we call oxidative stress, so meaning stress at a cellular level, because then the cells are not able to work at their optimal levels.
Yeah.
So there's compromise in terms of what the cells are supposed to do, how the body is supposed to take care of itself, because the damage that happens on a cellular level will manifest or to us as a disease, as a symptom. That's how the body actually communicates with us.
I spoke about my mom, so let's talk about our mothers versus us. So much has changed. Like you're saying, our mothers used to walk. They used to spend so much time outside. They didn't have cars, and they are stronger. They look stronger than we do. Let's talk about menopause, our mothers versus us. Why didn't I hear her talk about it?
I think with what you've summarized now, that's it, because we cannot ignore the changing lifestyle today compared to how it was then.
Yeah.
So we cannot say they didn't go through it. It's a natural process. It does happen, and it did happen. But they probably didn't have the symptoms at such an exaggerated intensity like us that we're experiencing now, because remember, we have access to so-called resources. We have more options. We choose what to do, where to go, what to eat, what to drink, which unfortunately has a ripple effect on the quality of our health. So now you're looking at a history of mothers who come from, we're talking 30 years ago, 40 years ago. South Africa was still under apartheid at that time. So the average black person had to walk everywhere. You couldn't just eat each and everything that you wish to eat, but that limitation actually saved and improved quality of life, because then cells were not as stressed as they are today. So now the intensity of the pressure that we have today because of the modern lifestyle, the life of affording, has created such a hostile environment in our own bodies. That's why you notice the high rates of disease, non-communicable disease, so the disease that are not caused by infection from one person to another. It's a lifestyle type of disease. So where does that come from? So it's coming from the change in the lifestyle. So they did experience it. But it was not as intense as we're experiencing it. And also we have Google today, we are talking, there are talk shows, so we are more aware of most of this information, then you become self-aware, and then you start diagnosing yourself even earlier. Everything's exaggerated, and let's not forget the stress that is always existing, just the stress in our daily lives. Stress alone puts the body under so much pressure, and then once the body is not able to recover and heal itself, then it's going to manifest in other ways. So we tend to experience this in a more intense way because of the change in our lifestyle. The so-called the good life is actually costing us way more than what our parents experienced.
And sometimes I've also realized, it's not because of lack of knowledge. Sometimes it's the language. I get a language, your language, estrogen and whatnot. Let's break it down in a simpler term for someone who maybe don't understand what are hormones, what is estrogen. I guess I understand that. Sometimes I know my body, but the term studying, a topic is more heavier than it should be.
Yeah. So menopause. Nka bolela ka Sepedi ge.
Yes.
So ge re bolela ka menopause, re bolela about nako e fihlang for mmele gore a isa dira bana. And then mmele a o tetaole, mmele o na le dilo tse di lalang re di bitsa di-hormones in this stage. Akere gore di-hormones ke tsone di kgonang go botsa ovary gore mo maya dulang gore okay, a re ntšheng leye re o nyakega ngwana. And ge re sa ye kgweding, ge re sa hwetse ngwana, then re ya kgweding. Then go fihla mo mmeleng gore okay, re feditse go dira bana jwale, and ke ntho e leng gore a kgethe ke rena, go kgetha ke e she dirilwe ka mokgwa. So mmele o fihla mo okay, nako e fihlile, and because a re swane o mongwe mo fihlela too early ke pele ga nako, so to say, o mongwe tlo fihla mo la pelenyana. So ge nako eo e fihla, then o thoma go kwa phapano ya gore okay, a ke sa sona le ka mokgwa ke te tsebang, ka baka la gore dilo tsela ne di botsa mmele gore okay, ntšha le ke nako go dira so, cause di re thuša gore re tekwe re le right, di na le mohola o mo specific mo mmeleng wa rena gore o tekwa jwang, o nagana jwang, energy ya go e jwang. So once mmele o fihla mo o reng a re sa dira bana, re tswalela factory ya go dira bana, so le wena o tlo thoma go fila le before go fela totally, before go tlo tswala factory tswala total notice eo melokra notice gore tlo tswalela notice once e tsena gore tlo tswalela then go thoma phutha-phuthiwa jwale wa phutha-phuthiwa
you're explaining it better. Shopo ya kwala
ya tlo tswala ke notice tsene jwale se go tlo phutha-phuthiwa mola then gore mmele o sa ba le lo je ne na le tsona before then o tlo thoma o te gore ke energy o sa na le matla ka mkhono ona le ona before le marapo nako ngwa ba wiki di muscle tsona tone ya e thoma go theoga a o sa robala ga botse go shego go kwa go fisha o kwa go tonya o kwa go fisha o kwa go tonya and then le go kopana le motho wa gago o kry le gore o ba bohloko because part of the changes tse gore ge go ntse go phutha-phuthiwa so ntho ene re hloka gore e thushe gore ka mo ge le tlo kopana go be borutho a e sa le gona kere so go ba bohloko ka nako le gona a o sa ba le takatso ya gore nyoko dira taba ya mohutong ene ka nako ke frustration because motho wa gago wena a tsebe gore wena o shokile notice ke
and our partners don't want to educate themselves with what women go through. Like, as a married woman, what advice would you give to married people who are watching this? Because like you're saying, think about it now, all of a sudden my woman used to initiate and she used to want sex and whatnot. All of a sudden I don't want to have sex. I don't want to be touched. And not because she doesn't want to, it's because she's going through something. How can men educate themselves with what we go through as women?
I think the men must be capable to learn, I guess.
Yeah.
And capable, willing, because we need both.
Yeah.
I be capable and I be willing.
Yeah.
So whether again, it will have to come from us first as ladies to say, or educate them because we also make very bad decisions during this time. Because remember, right, you end up the divorce already because you think, okay, maybe I don't like this person anymore, maybe because of this and that. Because even your cognitive brain, or the part of your brain, your decision, just sober, just practical, is affected. So you end up thinking, okay, maybe mutu aksamrata or so you start making decisions that are not even necessarily rational because they are more emotional because of that whole hormonal roller coaster. So just because of all of that, if you are not aware, even most women who don't even understand that some of their decisions that are made during menopause or perimenopausal state were not the right decisions. They were under the influence of the hormonal imbalance. So we really have to start educating ourselves. Okay, it affect it affect the energy, affect everything, because estrogen le vitamin D they are very, very critical to all of those, to mood, to energy, sex drive, libu cholesterol, libu pelo. That's why then around menopause, most women end up diagnosed like high blood, remotonal high blood, remoto depressed, remoto, and all those things are just symptoms of a central thing, which is in this case, estrogen has dropped. And kind of go vitamin D is low because the more you feel down, the less likely you'll go outside and take walks and exercise and be active because already you're feeling down. So you feel sorry for yourself, you're angry with everybody, you're that lady at work, because you're just grumpy. And it's not that you're so bad, but you're going through such a mess.
Yeah.
But and but like everybody and more and more education around menopause. As doctors, the more we understand, then we'll be able to know, oh, okay, the central problem here around this age group, because the symptoms seem similar. And some of the diagnoses we can actually prevent just by supplementing with adequate levels of vitamin D, because as the estrogen is going down, we definitely need our vitamin D going up. So that vitamin D is going to cushion us a lot from the effects of those low estrogen dips. So in summary around this, okay, let's educate ourselves and then be willing to explain to our partners how we are feeling. Don't take it personal, because when the man doesn't know, then he thinks you are doing something wrong.
Yes.
Maybe you somebody. Why is enjoy?
Yeah.
And gonna go like yeah.
Yeah.
Little
Yes.
Gonna go and okay, why? Because you also don't understand, okay, why am I feeling like this?
Yes. I think you summarized it right, because how go Luenda, you don't know what's happening to your body.
You're not rational.
Yeah. When you say it also affects, like I had a friend who it affected her and she got depressed and she was starting to have suicidal thoughts. But now already as women, we have stress. Besides menopause, we have stress at work, we have stress on that day, we are gagoisha every day. Now, we put that stress aside and then join it with the stress that comes with menopause. How can we help ourselves when it comes to just daily stresses that we have as mothers, kuntlung, single moms or married or kumusibetsing? The stress is something that is so difficult to manage.
Yeah, definitely difficult to manage, because remember, we're also in an era mo e leng gore dilo di a tura.
Yeah.
And mo le go nyakega tšhelete akere.
Yeah.
And then gore o kgone to afford it, you're working more and more. Okay? Then part of that is then it disturbs the stability in the home, because you're working to afford the lifestyle that keeps rising. So you never even catch up. And gonna go as the modern woman today who is supposed to do everything for themselves, then you find yourself having to go the extra mile to prove that you're capable, you can do this. Only standards, only this and this. So there's also an element of putting extra pressure on ourselves based on the standards that are set out there and which are not working for us. So part of me saying that is, let's simplify our lives. Remove the pressure. Just remove the pressure of expectations, of meeting people's expectations from outside at work. Keep things as simple as possible. Have structures in the home and start entertaining the idea, or what can I do? What type of job, or what can I do within my job to actually create time at home? Because as a woman, you cannot avoid the idea of home, children, and your partner. And we should not accept that idea that we should avoid it. It's not practical, because the person who suffers is who? The kids. And when your child is stressing or struggling, it's coming directly back to you. So now we should entertain the idea of, let's just be practical, let's be mothers. There's a reason they were called mothers. The body is designed in a unique way for a mother compared to a father. So we mustn't feel bad about being gentle, being soft, being goofy for our kids. My son likes saying, he's 6 now, mummies are soft and cushy. There's a reason a 6-year-old has figured it out, that a mother is soft and cushy and the father is strong and hard. So even children can figure that out, but we are stuck in the idea of, no, I'm tough, but the toughness is not working for us. It's just putting more and more pressure. It's putting more and more pressure, which then has a direct effect on our own health. So just accepting that it's beautiful to be a woman. Enjoy being a woman and structure your life around being a woman, because your power lies right there. Because you have better structure when you have alignment with your nature, because you can't change your nature just because the environment has changed, the business environment has changed, the political environment has changed. Because now when we resist the alignment, that's what causes the stress. And then coming to the physical stress is doing the basic things that we all know but find it difficult to do. Of course, you must exercise. At least 20 minutes a day, at least 3 to 5 times a week. You don't have to go to the gym, because my patients like say, oh, I don't have time. I've got projects, and I'm like, YouTube or Google or home exercise. 20 minutes in fela, or take a walk. 20 minutes is adequate, 3 to 5 times a week. Of course, we have to choose the food that we eat. As much as it's difficult, we do have to have that, the intention to eat food that are as good as possible. But the trouble that most women face is that the cravings, even if you want to eat healthy, the cravings overpower you. And then you want to eat healthy, but you end up eating what you didn't want to eat. So there's that conflict. But what I've realized now with the formulations that we have with our supplements, we're able to suppress cravings. Because cravings basically is just the body's way of asking for help. Like, I'm missing something, please give it to me. But we don't always know what the body's lacking at the time. So we just keep eating. And until the body is satisfied in what it needs, you'll continue having cravings. Even if you use things to suppress your appetite and all of that, as long as the body knows that I'm lacking with this vitamin, I'm lacking in this mineral, it will keep giving you cravings until you fulfill it.
So if you're craving cake, it doesn't mean your body needs cake.
That would have been nice.
It's lacking something. The craving
is lacking something nutritious.
Not cake.
Not cake. Mara yona message yona can be deceiving. Utla ile cake so. And o te pona le wena le cake le kopana. And a jolly funny thing, ka le fetso kopana a o kgotsofala.
Right.
Because the need was not met.
Yeah.
So now that's why with our formulation is done in such a way that we meet the body's basic need. What does the body need? So whether you're a man or a woman, everyone's body needs vitamins, minerals, amino acids, fats, and probiotics because of our poor health. So our gut is not good to absorb good things. That affects the whole cycle. So our approach is that we meet the body's basic building blocks to build this house. And once you give the body this basic building blocks, it knows what to do with it. You don't have to tell the body what to do. Then suddenly the body calms down. It can heal itself. It can rejuvenate itself. It can keep you vital. So, but as long as we're doing everything else, people are selling this to us, but no one is correcting the nutritional deficiency. The body's still lacking something. The cravings don't go away. And then if the cravings are not going away, what is coming next? We're going to be overweight, obese. Once you're obese, what happens? We're going to say you've got diabetes, you've got hypertension, you're depressed, everything is interlinked. You can't sleep. All of that is interlinked. So if we can centrally give the body what it needs, suddenly the body just starts working. When you exercise, you can actually exercise. You have the energy to exercise. When you need to sleep, suddenly you can sleep. When you need to eat correctly, suddenly you can eat correctly. Because the body will know what to do with those basic building blocks.
Yeah. And we also touched on sex and the libido dropping. So for a married woman, obviously, you at some point you not whether you have to, but you are gonna have to,
You have to.
sleep with your husband.
Yeah. Because these are the things that are causing stress. So like, I don't have to sleep with, and
but you have to.
You have to. Because why are you with this person? Because you're not business partners.
Ke motho wa hao.
So suddenly you're like, decide. Okay.
Yes.
But then this wasn't supposed to be a husband or your wife, so to say. So we have to acknowledge, the terms of relationships and be honest with them.
Okay.
And if the relationship, obviously by the time somebody says, I'm not going to sleep with this person, obviously whether it's hormonal problems that you can't make rational decisions, or is that you actually chose the wrong partner from the start, because that's a big thing. Where you didn't choose a compatible partner from the start, then obviously the relationship is strained. And then you're going to end up hating marriages, you're going to end up hating men, you're going to end up hating all of that. And there's nothing wrong with those structures, with those unions. We just have to be honest with ourselves that we didn't do due diligence from the beginning. So and then what do I do now? But don't make all men bad just because the one that you are with, you guys are not compatible. You don't have that thing of being considerate to each other, working together, being able to communicate, and actually enjoying sex. You're supposed to actually enjoy sex with your partner. But that's if you did your due diligence and say, okay, motho, background, religion, finances, are they more cultural? Are they religious? Do they have other kids? Do they health-wise? So that is due diligence. It's like a whole interview, which most of us are not doing because we're going with the flow. You're like, eye contact.
Or like, sparks.
Antebel, like I'm yeah. He's the one.
Yeah.
Then we didn't do due diligence. Then once we're in and things are not going well, then we're crying, or okay, abusive, this man is cheating all the time, this man is always drunk, and all the things that we complain about. But when you check, did you do a bit of due diligence and check, do you know this person? Are you comfortable with what you know? Are you going to be able to go through what you know? Because most of the time we discover things along the way. Or you saw it at the beginning, like, no, get like Lukisha. Then it only gets worse because you already found it like that.
Yeah.
So then that makes the relationship even harder.
Yeah.
So we have to look at relationships where on average, okay, you do have to go there. So now the question, perimenopause, okay, how do you improve that?
Yes.
How do you survive that? Because once re dila ka perimenopause, now heading to menopause arena, estrogen, hormone theorile, vagina dry, libido is definitely down. You're not excited. You only have negative thoughts about your life. And everybody, and like how you enjoy still on average. So that's where we also bring in. So currently what my approach is, before I even start treating hectic, like if you're coming to me, you're complaining about 1, 2, 3, and it's not severe or it's about to start, I always say, let's do a blood test. I need to know your vitamin D level, the same way that I need to know your blood pressure. I need to know your iron stores, your ferritin. Then I'll just check on each system just to see where you are, because I can't really talk to you or deal with your symptoms or diagnosis if I don't know what is your base.
Got you.
Then once we start there, if we need to supplement, we supplement with that approach of giving the body the vitamins, minerals, amino acids, fats, and that probiotic at the right dosing. Once we do that, what I'm finding is that most of the patients that I would have given medication for depression, I don't have to give them anymore. Suddenly they feel good. They don't need antidepressants. Somebody whose cholesterol was starting to rise up, suddenly it goes back. Somebody who was pre-diabetic, suddenly it goes back. So the approach is, let's give the body the basics. And then once you give it the basics, the body knows what to do because it knows each and every system in the body. But once the budget is low in terms of resources to take care of the body will also prioritize the vital organs to keep you alive, which is the brain, the heart, the kidney, lung, because your reproductive system is not a priority. You can survive without that. Mara jwale, in real terms, in a relationship, what you do when you don't have libido, when you're struggling. And I'm finding that the challenge that I'm having now with the ladies, and interesting enough, most of my patients are between actually the age of 35 and 60. The new challenge that I have now is once we start supplementing them well with this approach, now the libido is high.
Higher than
those who didn't have it have it. Those who had kind of average now is more. They're the ones that are chasing their partners now, and the partners are like, okay, so I've got that new problem now. Like, yo, I'm the one doing the chasing now. No,
I think it's better.
Oh, but it's a better problem.
It's a better problem
because what it means is once your libido is up, what it also means is you're generally more vital.
Got you.
Because it means if the body can prioritize your reproductive system, it means it has enough resources to take care of the vitals and all the other organs. Okay. Remember, that's why around the same time we're starting to lose our hair, because hair is not a priority for the body. If the resources are short, hair is not a priority. So that's why the hair loss.
When you get older.
As you get older. Remember, under general, everything decreases with age. So now if things are decreasing with age and our lifestyle is not supporting that, everything just becomes worse. So now with the information that we have now is, as things decrease, now with the knowledge that we have, we should be increasing on the things that we know now they're going to sustain us through this drought era and give us the vitality we need, the excitement we need, the energy we need.
Sure. I'm coming for those tests.
Yeah, block no break 2 days. Recover.
And you're so right with the hair. I've seen like hair, even the eyebrows.
Yes.
The older you get,
and the skin is sagging also. The hair everywhere is starting to fade away, saying goodbye. Yeah. And it's because as we grow older, resources are being depleted. And as you grow older, the stress levels also go high. So the demands on the body for the resources that are there increases. But then you're not replenishing what is being taken. Because people are getting sick in your life. Miracle can be a challenge sometimes. And for most of us as Black people, we never had time to actually spend with our kids because we went in trying to push and prove that we can make money. So we never had time with those kids. So when they hit their teenage years, now suddenly the kids are giving us stress. They're struggling with their own mental health problems. They're struggling at school. They're struggling with relationships. They're using drugs, and all of us are like overwhelmed, and which is fair. But it's because then we didn't take the time to understand and say, how does everything affect each other? Because you cannot separate what happens at work, at home, the community, the economy. Everything is interlinked.
And how can families support a woman who's going through that, like, not just their husband, some women don't even have husbands, but like families around them, just to support during this difficult time
during menopause. I think support is nice, but what will be ideal is let's just correct the body.
Got you.
Because it's a physical problem. Because now, as long as you have support, it's like instead of fixing the bone while they support you and heal. Okay?
Got you.
So we actually have to correct it's a physical problem because it's a natural physiological process. So we have to physiologically check, where are you? So we check the meter. What is your vitamin D meter? What is your ferritin meter, which is where we store our iron? What is your cholesterol looking like? What is your liver looking like?
Mm.
What is, so the basics, because once we can identify where the problem is, then we can correct it. Then the body is able to correct itself and support you, compared to not doing anything and then saying people must support you, or expecting people to support you about something that they don't even understand themselves. So to simplify it is, if we can understand that menopause is a normal physiological process, and we understand what is happening physiologically, then why don't we correct it physiologically? Then we just replace what is short. We do have options of using estrogen therapy for women that are going through menopause, because I get what has changed drastically is the estrogen is going down. But what is also happening with the modern woman, vitamin D is down as we speak. The average black person now who has a car, I can tell you now, the vitamin D is most likely low. Because when are you going to get the sun? And molalo now is like, I'm like, oh, I don't want the sun. Okay. Then that's where the problem is starting, because the same thing that we need, the very thing that we need, right? Avoid it because I don't know dark. I get glow, complexion. So so that's where things just so, but that's why I like saying, let's just simplify everything. What is the core? What is the crux? Where do we start? Let's just start on the base, have just a nice building block, correct it there. Because once you correct the building blocks, the body knows what to do. You don't have to tell the body that, okay, take this iron, if malume ya gago o ka kwa living, or we shake is in the kidney. No, the body is intelligent. Give it what it needs. It knows what to do.
Yeah. And for someone like me, like I said, I'm 36, I have one child, or someone who doesn't have a child, and they are at my age where it's like perimenopause. Are there any dangers of being pregnant at this age, when you might be
going through your entering
your perimenopause stage?
Yeah, that's a very good question, because you have a lot of women now, black women in particular, that now you want kids. Over 35. Actually,
I should have.
Actually,
I should have.
but not when you look back. There's no you could have done it then, because career never major. Your time was needed then. So now between 35 and 40, now we want kids.
Things are slowing down.
And when you're comfortable with yourself, you don't have pressure of pleasing anymore. You're like, gradually you also, when you're getting into your comfort zone of just being yourself. Like compared to 10 years back. So the best advice that I give my patients every day between 35 and 40 is, yes, of course you can have a child. It's not necessarily dangerous, but it depends on your state, the state of your health. If you're not healthy, it's risky for you to have a child. Because remember, by the time you're 35 to 40, before we used to say once you're 35, you're high risk for having a baby. But now we're seeing that with how things are evolving, we still have mothers that are getting babies between 40 and 45. But what we need to keep in cognizance is optimize your health status. Because if you do, you improve the quality of the pregnancy. And the outcomes for the child, because then your body has more than enough resources to take care of the pregnancy, and the baby comes out healthy. Because once the mother is deficient, the baby will be born deficient. Because why would the baby not be deficient if the mother was deficient? And our research is showing that the high levels of autism and ADHD in children, which is very common now, it has kind of skyrocketed. It has a direct link with the mother's vitamin D levels, the mother's ferritin levels during pregnancy and before pregnancy. So now that we know, I always say, can we prepare your body? I just need a good three months supplementing you to give your body enough resources, and then you must take care of yourself. Then when you fall pregnant, then it's easier for the body to handle it. We're expecting less complications during your pregnancy. We're expecting a healthier baby, because you can have somebody who's younger but who's also not doing well, nutrient deficient, have problems at home or stress and all of that still have a pregnancy that things don't go well, but they were young. So it tells you that it's not about the age per se. It's about the state of your health and the ability of your body to carry the pregnancy.
And is there a point where menopause is done? Or like,
There is.
and then why how we una now feditse then you go on your period all of a sudden don't ne ke feditse ka menopause in their late 50s, and then all of a sudden they see a period.
Yeah, so menopause redefine as you didn't see your period for a straight 12 months. It's not like you didn't see it for 3 months,
Okay.
after 2 so it has to be a straight 12 months of no periods. Okay. Then we say that is menopause. And then if that has happened, so meaning you've reached your menopause, you haven't had your periods for a full 12 months, and then suddenly you have bleeding, because that happens. We call that post-menopausal bleeding. In that case, we are worried about cancer, because you're not supposed to bleed after we have declared you as menopausal. So now we have to investigate, why are you bleeding after menopause? Then we have to identify the cancer. Most common would be cervical cancer or endometrial cancer. So just the lining of the womb. Then we have to investigate. Because remember, as the estrogen drops, vitamin D drops, and you're menopausal, the HPV suddenly also gets a shot at you. HPV is the virus that causes cancer of the cervix, which is, if not the most common cancer for women. It takes a shot at you because your immune system is totally dipped. So now it takes it. That's why then ladies who are postmenopausal have a higher chance now of getting cancer, but they've been doing their pap smears, it was fine. Then suddenly also now postmenopausal, then you find that somebody has cancer, but they didn't have it before. But remember, as the resources go down, estrogen is going down, vitamin D is going down, because of the lifestyle. The more you feel down, the more you don't do anything. Around that age, most women have retired. Then those that have retired are not active anymore. Most of them are not active. And then that's where you actually need to be active. Because once you pack, you age quicker compared to somebody who is active, who is waking up and doing something, who is also doing their health checks. Because sometimes we just undermine doing health checks. Like, it's not for us. I don't know who it is for. Like, it's not for us. So, but those health checks, they're very useful because we're able to pick up things that we can intervene on on time. Then we can do something about it.
And dementia, it does affect more women than men, right?
I'm not sure about the stats around that. But obviously, women, I work with women most of the time. Women would tend to show, because we are more emotional beings, by the way, we tend to show depression more. So with men, it's difficult to pick up depression because of, their testosterone levels always have to be high, they always have to go out. So whether they're happy or not, the average man is able to go out and get stuff done. But with women, it's easier to see it, to feel it. Because we also just feel that we are women, we can just shout at everybody and just be moody. But we don't expect that from a man. So we hardly pick it up too soon with men in terms of depression. With dementia, for sure, I'm not sure who has a higher prevalence between men and women.
So it doesn't, the menopause and the estrogen levels going down, it doesn't contribute to maybe a woman end up having a dementia.
It does, because remember, both estrogen and vitamin D have protective and regulatory functions, meaning they have a function to balance our mood, our mood, and the brain, where we make cognition, making decisions. So when those drops, we do expect changes that are brain related. Because the resources have dropped, the brain protective resources have dropped. That's why we also have then the cardiovascular, which is around the heart and the blood vessels, because both estrogen and vitamin D, they're protective. They're cardioprotective, so they protect the heart and so that's why then suddenly hypertension, we start making those diagnoses of hypertension around that age. Atherosclerosis, cholesterol is up, diabetes, they kind of all happen at the same time, but they're all interlinked, because now those major two have dropped. So now imagine then if we can lift at least one and supplement with the other, because the question for other women is now, do I go for estrogen hormonal therapy, or do I just wait and see? It depends. It depends on your symptoms. It depends on the state of your health. For me, I'll always start on the building blocks. Once we've corrected that and supplemented you adequately, and then we find that we're still struggling, then we can supplement with estrogen. But it's different for everyone, and as colleagues, others might feel like they want to go straight for the estrogen. But I guess with me, because of my focus in oxidative stress, I always go to the foundation of saying, how do I reduce the oxidative stress? Because if we reduce the oxidative stress, most of these things are managed. So I would say then, let's correct the building blocks, get you in optimal health. And then if we still have symptoms, then we can consider supplementing with estrogen.
Yeah. And then weight is an issue for us women, whether you gym or not. There are women out there, I gym. I go 3 times a day, mare especially around that age, menopause. Does menopause affect your weight? And for a woman like that, what can they do to help them with their weight gain?
So if we go back a little bit, remember we said once our estrogen drops and our vitamin D drops, there is a direct relation now in terms of how the body regulates the immune system, how the body regulates lipids, which is your cholesterols, and fat distribution, how the body regulates glucose metabolism, which directly has a direct effect on weight. So that weight is specific for menopause because when the estrogen drops, the vitamin D drops, then we have dysregulation in those areas. So automatically then you have problems with fat distribution, meaning, and you also notice that where the fat goes is a unique place.
The stomach.
There's a unique place where it goes, because we have what we call dysfunctional what is the best? Okay, let me keep it in a simple way. So basically the lipids, the way that they're usually supposed to be allocated, where they're supposed to be allocated, reducing the bad, because we've got a bad cholesterol and good cholesterol. So there's a dysfunction around that. And the glucose not being able to be metabolized effectively then causes the weight gain. Keep in mind, then we said, if the vitamin D is low, you're going to have cravings, because vitamin D doesn't even work alone. So if your vitamin D is low, most likely your magnesium is low. Zinc is going to be low. So there are cofactors that work together. So when you take a supplement, you want to make sure that at least there's the vitamin D, there's the zinc, there's the magnesium, a bit of vitamin C, because they all work together. So if you only take one, unfortunately, that you don't have optimal, what are the most effective way in terms of absorption, like compromise, because now that's why we need the vitamin minerals combination, because then the body absorbs it best and uses it best. So now once that drops, it's going to affect the weight. Mokhaba ola, unique. Then, like you're saying, somebody exercises, but mokhaba uzamai, right? And also keep in mind that vitamin D is all over the body, the whole body. That's why then, as you get older, we lose muscle. Because the vitamin D affects the muscle mass directly. So that's why now the supplementation becomes critical, because when you supplement with vitamin D, then there's regulation now around the cells on the muscles can now become more and differentiated, then muscle mass increases. So that's when you exercise with good nutrients, so to say, you start seeing the effect. The energy is up. When you exercise, you actually see that the muscle is starting to build up. So that's why even for older men, for them also, as the more the vitamin D goes down, their muscle mass also reduces, because the vitamin D is a direct effect on bone and muscle. So what am I saying? We have to go back to the building blocks, because even if you're trying to using the best appetite suppressant, using the best whatever, and you're exercising, but on a cellular level, we're still lacking the building blocks. The body cannot do anything. You're still going to have cravings. You're not going to get the results you want for the effort that you're making.
And then supplements. For someone old high watching, they've never taken supplements. But the common vitamin C and what. Is it too late to start? And if it's not, where can we start?
It's never too late to start. As long as you're alive, you have to start. Because if you don't, your body will suffer and you suffer. So information is like this. Once you know, do something about it. If you don't know, you don't know. But once you know, implement. So the best thing is, they can go to their doctors, do a basic check, ask specifically for their vitamin D levels, ask specifically for their ferritin levels, because those two alone are going to help us make very critical decisions. Then when we supplement, we also want to make sure that we're supplementing at adequate levels, because sometimes we're taking supplements but they're not adequate. Then we don't even know if we're making progress. And ideally, we also want to monitor. Once we start, after 3 months, we must see how the body is responding, because we can't just give something that we don't know how it's affecting the body. Are we getting the results we want? And if the supplement is effective, the cravings are supposed to stop. Within 5 days or so, you should start feeling like, oh, my cravings have stopped, because you've given your body what it needs. So with I will talk about my supplements,
Yes,
because
yes, I was about to ask about.
yes.
That was my last point. Let's talk about your supplements before.
Yeah. So my supplements were formulated intentionally to meet the need. Because there are a lot of supplements, because I discovered myself that my vitamin D was low, my iron was low. And I think that shook me a lot. And after that, I think for a week, I just shut it out of my mind as if it never existed. A week later, I was like, okay, but this is not going to disappear just because I'm ignoring it. What is the solution? Then I started looking around, and I couldn't really find something that will meet the needs of what is, your daily requirement. So that's when then I realized that, okay, maybe it's better to manufacture my own, where I actually have control in terms of what is going to go in there. So that for my patients and those that I get to talk to, when I give you the product, it must actually work. You must actually feel the effect. I don't want to just keep you busy. I want you to say, wow, I took it and this is what is happening. They must talk for themselves. So I can't talk for other brands, but with what I have done, I made sure that this has to be impactful. It must be worth the money. It must be worth, the hope that you're hoping to get, without over promising anything. I always say, let's do the bloods first, see what is happening. And then from there we supplement based on that. We can always monitor to prove if what we said is actually the same thing that we identified. Are we solving the problem?
The supplements, I understand why you started them, but if one wants to start with your supplements, is it a must for me to get blood tests, or I can just buy your supplements wherever you sell them, which is where you will tell me where you sell your supplements?
Yeah, so based on the dosaging of our supplements, you have to do a blood test first. Because of regulation issues, so we have to comply. So it's better that we test. Then after testing, then we can start you on the specific vitamin D containing supplements. Other supplements are available, but for the context of this discussion, the ones that have the vitamin D, we do have to test, then release it. So on our website, we've created the process to be easier, that once you've identified it, then it will lead you to our appointment system. There'll be a doctor who will call you, and then we'll give you a form to go to your bloods. Then our system will pick it up, present the bloods to you, say, okay, this is where we are. Okay, this is what you're going to use. And then after 3 months, then we just follow up. But already by that time, we expect that you already know if it's working for you or not.
Okay, so this is before you take the supplements. Like, you go through the process of going to your website, and then do the blood test, and then and you will know which dosage you you should put me on.
Yes.
Okay, and then when it comes to the supplements, do we have to take them with other supplements, or you have to just focus on the vitamin D?
You have to take them with other supplements. So our approach, which is physiological, we've created in such a way that we've created like a combo, a package in a way to make decision making easier. So there's vitamins, there's minerals, amino acids, fats, and the probiotic. So we have that. So you don't have to figure out, okay, which one should I? So we create it in such a way that it's easier, that this is the most ideal pack for you to start with. Then if you're doing this, you're meeting the body's basic needs, then the body knows what to do.
And lastly, doctor, what advice do you have for women out there? Like you said, udutsi, the body is just not bodying, they're not feeling well, and they know that this might be the symptoms of menopause. And also just in general, advice for women, because we really do go through a lot. And every day we face so many challenges being a mom, I read in Bogoto, but we have this thing now, I can do it by myself. What advice do you have for women who are watching you right now?
I think for me is women must enjoy being women. It's beautiful. But what makes it even easier is if your body can support you. So you support your body to support you. and then you do what you can.
Yeah.
We know that there are challenges that we're all facing every single day, but decision making is easier when your body is feeling well. Because how do you go higher when below is not yet fixed, it's not grounded, it's not supported? So we must do what we can with what we have, start where you are.
Yeah.
And always know that you are enough as you are, in terms of you don't have to try to prove something. You are more beautiful, you are more rich. No, just keep it easy.
Yeah.
And just enjoy being a woman. It's beautiful.
Yeah. Yeah. Thank you so much for joining us, Doctor.
Thank you.
I had such a beautiful conversation. Your website will be on our caption so that people can see. Linda, I'm coming for those tests. The chances are high. You're on vitamin D. Thank you so much for watching Mommy Diaries.